this Saturday for Fighting Lupus Symptoms with Nutrition and Lupus 101. It's presented by our presenting sponsor, GSK and Us and Lupus. And I encourage you to check out GSK, Us and Lupus, and also Wellness Vida Chiropractic. We have Dr. Eve with us today, but please note that this program is not intended to take the place of your doctor. Please don't start or stop any new medications before speaking with your doctor. All right, Dr. Eve.
Hi, everyone. I'm Dr. Eve Aragon. I have a practice here in North Dallas, off 635 in Preston, and talk today something I'm really passionate about, nutrition. And so I myself suffer from autoimmunity, and a lot of things that we're going to cover today on nutrition can be used for a lot of lupus sufferers, but also for other types of autoimmune disorders. Okay. All right. Okay, so this is a pretty popular quote. I'm sure many of you have seen on your Facebook or Instagram, "Let food be thy medicine and let medicine be thy food." It's such a beautiful quote, and sadly, the food that we consume today is not enough to provide the medicine that we need for many of us. A lot of the fruits and vegetables that are grown today have less nutrition because the soil has been depleted over years of overuse, and there's pesticides and the pollution. All this stuff is going on. Doesn't take to the fact that we still need to eat as healthy as possible with fruits and veggies, of course, and eating grass-fed meats and organic and things like that. We also need to perhaps supplement with some supplements and vitamins. Okay. All right, and just to get started, I got a disclaimer here, like Adrian said. This is just nutritional advice. I don't want to go over the advice of your medical doctor or whoever's treating you, but sometimes just use some caution before trying new supplements. And also, supplements are not created all equal. There are so many options. If you go to Whole Foods or Sprouts, I mean, even Walmart or CVS, there's just like a huge aisle with all the stuff. And there's just so many options, and you have to be careful and not buy something that is filled with fillers or just buy products that are not very good for you. And one advice that I have is don't buy your supplements at Walmart or CVS or even Target. Try to go to a shop that that buys supplements that are higher in quality, like Whole Foods or Natural Grocers, Sprouts. They typically have higher quality. Not to say that every single one of those that they have there are all good, but at least you're looking at a buyer that buys better quality supplements. Okay. All right, so we're going to talk about some supplements that I love to use personally, and also I know that other lupus sufferers take these. So vitamin A, it's very so your food sources from vitamin A is butternut squash, sweet potatoes, kale, carrots, and some unique features also. It helps with sun sensitivity. I know a lot of lupus sufferers, they're really sensitive to the sun, and it helps reduce inflammation and antioxidants. And the overall benefits are vision support, immune support, skin health, and cell growth. And it's important to note here that if you have poor gut health, when you can try to get more vitamin A in your diet, your body doesn't absorb it as well, doesn't convert it to the active form. So it's really important to get your gut health looked at first. So many people have leaky gut, and that's like a whole different thing we can talk about for hours. But it's important to get your gut health under control. Okay, this other supplement is is called astaxanthin. And you can find, if you were to eat a lot of wild-caught salmon, krill, it's also in algae, red trout, also in crabs and lobsters. And so it's very awesome because it's one of the most powerful antioxidant in nature. So maybe I'll say, well, what is an oxidant? So oxidants is electrons that, getting kind of too sciencey, but pretty much pollutants in our body with aging, with cellular process in our body, they produce free electrons, and those steal electrons from other molecules, and that causes, they can cause issues in like aging and even cancers and things like that. So we want to take antioxidants, and astaxanthin is a great one. Okay, and some benefits are they improve brain health, they protect hearts, it protects the heart, it's great for skin health again, and I have it misspelled there, but it can it's really good for taking it as like a workout enhancement, and it also boosts male infertility and supports healthy vision. Okay, so vitamin Bs. There are 8 different B vitamins, and B1 is thiamine, B2 is riboflavin, B3 is niacin, B5 is pantothenic acid, B6 is typically just known as B6, B7 but biotin, B9 is folate, B12 is also part of the B vitamins. And some good food sources is organ meat is like the #1, grass-fed meat, free-range eggs, leafy greens, and wild-caught fish. And the unique features is it supports nerve function. So I know, especially in autoimmune patients, we see a lot of nerve issues, like tingling and numbness in their hands and feet. And so B vitamins can help with some of those symptoms. It also helps with your gut, brain fogginess, when you kind of feel like in a haze, you can't think clearly. B vitamins usually gives you that boost of energy along with increased brain function. So overall, the benefits are B vitamins help form cells. So our bodies are constantly making cells, cellular repair. So we need B vitamins to be able to do that, and also helps fight heart disease. It supports metabolism and aids in fetal development. So if you're pregnant or thinking about becoming pregnant, it's so important to get your B vitamins levels checked and be up there. And also just helps maintain a healthy nervous system. Okay. Choline, I don't know if many of you have heard of this one. It's really related to the B vitamins as well, and especially with folate. And it has to do, so folate and choline, they both work together. And some food sources are beef liver. I'm not a fan of beef liver, but if you are, it's really packed with tons of choline. And its unique feature is that it's like for liver support. So I know in a lot of lupus sufferers, they might have fatty livers, and choline helps export the fat out and able to support the liver. And it also boosts your metabolism, and it helps with inflammation. And it's needed for methylation. It supports brain function and helps nerve communication. So since choline works alongside with the B vitamins, it's so important it supports the nervous system. Okay, the next one we have is AlphaGPC. It's a source of choline. This one is super important for brain function, and it's because it can cross the blood-brain barrier. Some B vitamins can't, but this one is able to cross it. And because of that, it can boost learning and focus and improve athletics and performance and improve recovery from stroke. So, and I have another practice, it's called Texas Dizziness Centers, where we work with patients that have brain injuries, that have strokes. And we recommend this supplement to a lot of those brain injured patients, just because it's able to just support the brain health. Okay. And also, again, organ meat, grass-fed meat, free-range eggs, leafy greens, and wild-caught fish were all great sources for this too. And it's unique, obviously, again, unique feature of this is improves memory impairment. And I know a lot of autoimmune patients, their big complaint is that their brain is kind of foggy, that they can't, like their memory is not as sharp, they keep forgetting things. So this is my go-to right here. Okay. The next one is bromelain. It's used widely as a natural remedy to treat many ailments. I don't know if you ever heard of this. This enzyme is primarily found in pineapples, especially in the core. And so you can find it, you can take advantage of this by juicing pineapples, or you can get like an extract. Some unique features is like, it's just a great enzyme to help with digestion. It's an anti-inflammatory. It's like a natural painkiller for people that have lots of joint pains or just kind of like achiness around their body. It's really good to add to your diet, and it helps with your GI. It's a GI soother as well with your gastrointestinal tract. And some benefits: it supports recovery, supports faster recovery. So if you have a fall or an ache, bromelain can help clean it up faster than usual. And it also helps with allergies and sinus infections and supports weight loss. So this is a great enzyme to take. I mean, load up on your pineapple, which is great. Okay, next one is vitamin C. So initially I was going to put oranges here on the image, but I found out that kiwi fruit has the highest source of vitamin C. And also bell peppers, orange, strawberries, and papayas, they all have vitamin C, but kiwi was number 1. So it's a powerful micronutrient. It's a very crucial part of our diet. It slows down skin aging, it reduces cholesterol levels, and you know, there's tons of research out there. I think this is like one of the most researched vitamin that's out there. It's just so many benefits from inside out. It's really good for people that have desk jobs because it helps with blood flow, and it's really good, and it's a really good anti-inflammatory. Okay, so we talked about it boosts immunity, it prevents anemias, and improves heart health, promotes glowing skin, and reduces the risk of gout. So that's vitamin C. The next one is chromium, and chromium works with vitamin C as well. Vitamin C helps the absorption of chromium. So chromium is an element. It's actually a metal, and it's a trace mineral as needed by the body. Some food sources are brewer's yeast, broccoli, and grapes, and it helps with triglyceride buildup. Like sometimes arteries get clogged up, and chromium is really good to get that cleared up. And so benefits are it helps control blood sugar and diabetes. It's good for heart health, weight management, and brain health. This next one we have is Cocutan, and Cocutan is also an essential element for many daily functions. So every single cell in our body requires Cocutan, and our bodies have the ability to make it, but sometimes doesn't do it consistently from stress, just from daily, when we're depleted nutritionally, our bodies are not able to make it. So it's, for some of us, we need to supplement this element, and we can get it from grass-fed beef, herring, which is a fish, free range chicken, rainbow trout, and sesame seeds. So some unique features are that it helps brain fog and it helps calms the blues. And some benefits are it sustains natural energy, it reduces free radical damage, improves heart health, and if you're on statin drugs, ask your doctor if this is okay to take, because sometimes the Cocutan can help reduce some of the bad side effects that statin drugs can have on you. And Cocutan is known to slow down the effects of aging. It helps you maintain your optimal pH and protects your cognitive function of your brain. And also another one good for male infertility, and it helps fibromyalgia. Okay, this next one is 5-HTP. And I know most of you have heard of serotonin, which is a feel-good neurotransmitter that we all need. That's our happy neurotransmitter. And so, excuse me, that's my dog wanting to go outside. Okay. So this one you have to get from supplements, and it's really good for sleep and mood enhancement. It can help manage anxiety and depression, and improves sleep quality, reduces pain symptoms as well, and it can help with weight issues. The next one is vitamin D, which is a sunshine vitamin. It is a fat-soluble vitamin that is present in small amounts in food, and made in our bodies when we are exposed to the sun. And at least 50% of Americans are deficient. So I recommend this vitamin to almost all of my patients, no matter if they have autoimmunity or not. Most of us don't spend a lot of time outside, and if we do, we have long sleeves, we have pants on, so our skin is not being exposed to the sun. And also the color of our skin has a lot to do with it. The darker tone you are, the higher the chance of you being deficient in vitamin D. And some unique features of it supports the immune system, and it helps with joints and improve your moods as well. Some benefits are that it contributes to bone health, helps manage blood sugar levels, helps fight heart disease, and it facilitates hormone regulation. And it's also really good for your brain. Vitamin K. So, so you can get vitamin K from eating kale, spinach, and Swiss chard. And some unique features, it helps bone loss. So vitamin K works really good with vitamin D on that note, and it prevents fractures. And some benefits are ensures healthy blood clotting, it promotes heart health, and it boosts brain function. Okay, so I talked about a ton of different vitamins and supplements and how we can get in our food and our diet. So how do we incorporate this in our daily living? So I have some options here. Option 1, improve your daily nutrition. That means every single meal that you have has to be like perfectly clean and like lots of vegetables and lots of fruit, and then your organic meats, grass-fed meats, chicken, things like that. That's one option, and we should all be striving for that option anyways. So have option 2, and have a health professional that is trained in nutrition to work with you. In our office, we are trained, me and Dr. Gonzalez. He actually has more training than me in nutrition. He's the one that handles all the nutritional aspects in my office. And then we have option 3. If you're not able to go to a health professional that's trained in nutrition, you can try 1 or 2 of these supplements, just at one time, and then take notes on how you feel. If they make a difference, if you need to contact your doctor if you have one, and let them know if that's okay. And then option 4, which is a terrible idea, just by everything that I had just said, and just leave them in your pantry and not do anything with them. Which actually a lot of people that it happens, I talk to patients, they're like, yeah, I have all this stuff in my pantry. And I'm like, well, why haven't you used them, or what's gone? You know, like they'll take a couple of pills for a couple of days, and then they lose hope, and they just leave them in their pantry. If you're trying a new supplement, I'd highly recommend taking the whole bottle and then taking notes on how you feel in the beginning and how you feel at the end, just so you know that's for you. In our office, we do a variety, we do different ways on how we can test if you need, what supplements are actually needed for you. We can do blood work, or we can do like a specialized, it's called applied kinesiology, where we do some muscle testing to see if that supplement is good for you or not. So I mean, I want to ask a question. What do y'all know? What's the most expensive supplement there is out there? Maybe you can answer.
I don't know. What is it?
Okay. The one that you don't use, the one's not good for you. So that's the one that is the most expensive. Okay. So it's good to make a good decision on what you're taking, and not just take vitamins just because people just tell you, oh yeah, I heard this or I saw this on Facebook or wherever. Do your research, buy high quality stuff, or have a trained professional guide you through the steps on how to incorporate some of these supplements in your diet. Okay. And that's all I got. If you want me to share this slideshow with you, I wasn't able to get it to Adrian earlier. You can put your email in the chat and I can send it out to you directly.
And then maybe you can send it to me too, and then I can go ahead and just send it to everyone who wasn't able to make it as well. Yeah, but we do have a few questions, and if you have questions, you're more than welcome to take yourself off mute and ask them. But can you explain more about your company, Wellness Vida Chiropractic, and then Texas Dizziness Center? Yeah,
so both businesses have been open for about 7 years now. We're in North Dallas. Texas Dizziness Center, in the beginning, that's where my main focus was on more. I have a neurologist and have a nurse practitioner where we see patients that have issues with dizziness, vertigo, and balance problems. A lot of those people have those issues because they have had a brain injury, or even with aging, or sometimes it's unknown. All of a sudden they wake up and they have vertigo. So that's where we help a lot of people with those types of issues. And then my Wellness Vida Chiropractic, we help people. It's for kind of wellness care, but also people that have pain, joint pain, back pain. We see a variety of problems such as like sciatica, disc issues with herniated discs. So we've helped so many people over the years with ailments. And autoimmunity has been really close to my heart just because I've been affected by it too, and a lot of my family has. So we have seen a lot of people with autoimmune disorders in my office as well.
I have a question for the group. Has anyone visited a chiropractic office or a nutritionist? Nobody? That's okay. Well, here's another question. Do you have a favorite supplement brand that you take?
I do. There's one called Apex. It's Apex Energetics. That was one supplement company that I use personally. And also another one is Zymogen, just great quality. They do a lot of testing. I don't even know what the name of it is, but they rate themselves, and they don't do it themselves. They submit their products to this company and they did the testing, and then that's really important because a lot of the stuff like at CVS and Walmart, they're not tested by a third party. Yeah.
Where can you buy those?
Typically you have to get those through a health professional. Sometimes you can get some of that stuff like on like through their own websites. Yeah.
Okay. And then at your office, do you accept most major insurance?
Yeah, we do. We accept most major insurances. Nutrition sometimes is not covered, like the nutritional consult, but obviously the insurance companies won't cover like supplements, things like that. But but for like consultation and treatment for musculoskeletal disorders, yes, it is covered, and we take mostly all major insurances.
Okay. And then there are people that can't be out in the sun, but they've heard of vitamin D. Is there a specific vitamin D they should be looking for, or like they're different kinds? Or
Yeah,
does it just say vitamin D?
Yeah, vitamin D. I recommend vitamin D and vitamin K to work together because you can take straight vitamin D, but the vitamin K, since it helps with bone health. I like to recommend both of them together. As long as we can get at least 5,000 and 10,000 IUs a day, that's a good starting point. There's some patients that I have that take way more than that. Like I really take more than that because I need it. I'm chronically deficient in it. But yeah, so vitamin D that has vitamin K is great.
Okay. And then do you suggest to people to try to eat their vitamins before they take the supplements, or do both? What are your suggestions?
Each vitamin is different. So I suggest taking it with food. Typically all of them. There's some that you can take on an empty stomach, but typically you want to eat them with food. So like the vitamins, you can take the vitamins like the vitamin A, vitamin D, like those you can take on an empty stomach, and all the other ones require for you to be eating.
Yes. Does anyone want to take themselves off mute and ask a question? We love interaction. Let's see. I did have another question, but I forgot what it was.
I have a question when you get a chance.
Yeah, go ahead.
Okay. Do you, doctor, do you do telemedicine, like consults because where are you located?
I'm in North Dallas off of Preston and 635, kind of by the Galleria.
Okay. So, no, you don't have any offices in North Fort Worth?
We don't, no.
So
no, but we can, we have done during COVID, we have started doing more telemedicine and doing some nutritional things over telemedicine.
Yeah, that would I have questions for the nutrition.
Mm-hmm. Yeah.
Thanks. I'll contact you.
That'd be great.
All right.